I want to talk about reason why women buy after childbirth or during the childbirth. It's so unfortunate when a woman bringing a new life and during that process she passed away or shortly after delivery complication arises. During that time the woman dies. It's so disheartening, bringing life at the same time the woman losing her life. You see? So what are the reasons? Because somebody asked this question. I saw a post. The person was asking, why will a woman die in the process of bringing a new life? One, bleeding. After delivery, shortly after delivery or hours after delivery, a woman can bleed. And when this happens in a severe way and there's no immediate intervention or proper intervention, the woman can lose her life. Another reason is when a woman have hypertension. Hypertension can lead to a lot of complication that the woman can go through and lose her life while bringing another life. Another reason a woman can die while delivering or after delivery is pre-eclampsia. There are a lot of it, a lot of reasons, but I'll just mention few. I've mentioned bleeding, hypertension, pre-eclampsia, where the woman have high blood pressure, she have swelling, that is edema, and protein in her urine. So when this is not properly managed, it can lead to eclampsia. Eclampsia is the woman's having fit and then a lot of a failure in her system. A lot of things goes wrong. And if it's not properly managed, the woman can die after delivery. Infection also. But infection usually after delivery. After the woman has delivered, she goes home most time. She can come back with infection, and if it's not properly managed, the woman can die. So what can we do to prevent this? Because it's not about lamentation. Why is this happen? Why? When we keep asking why, it will continue. We have to know when it happened, what can we do to prevent it? And there are some that is inevitable. No matter how we prevent it, it can still happen. But what can we do? What are the intervention that can be taken to prevent complication? Prevention is that when a woman is pregnant, it is important and her partner to go for prenatal registration. She and her spouse have to go and register in a qualified hospital with qualified doctors and midwives. Okay, not in the homes or where anything can be done and things goes wrong. A woman and a man have to go to the hospital and register for prenatal. And I will advise that even before the woman becomes pregnant, she can go for prenatal check so that while she's planning to get pregnant, she can be checked. Medication can be given, care can be rendered, and as soon as she becomes pregnant, she will go for it. She will go for prenatal booking. So when a woman is pregnant and she goes to antenatal, most time complication, even if it's going to arise in as much she delivers in that hospital where she register with qualified professionals, is always there's high chances of a woman surviving the complication. Remember, complications can happen, like the bleeding I mentioned. Even in a country where the medicals is an advanced level, it can still happen. But how is it being handled? How is care being given when complications arise? So prevention is always the best. Better way to manage life is to prevent it. So a woman that is pregnant need to register early. And when she register, not just to say, okay, I have been given advice to register, now I have registered. She have to be going for appointment. She have to go when she have any complaint. Like now she maybe sometimes she go to the hospital this week, and within the period before her next appointment, something happened that she cannot explain. She's doubtful of it. She have to go back to the hospital. Don't wait for the next appointment. Don't delay to go to the hospital and give complaints. So prevention. And when it happen, what are the care and around where does it happen? Because if a woman delivers in the hospital and she start having bleeding, due to can be due to many reasons. Because when a woman delivers, before the woman will start bleeding, something must happen. And majorly is because the uterine is not contracting, which medically we call uterine atony. It can happen. And the midwives, the medicals around me, they already know what to do. But when if a woman delivers in a place where they don't have this knowledge, they don't know what to do. Sometimes they even start applying prayers to it. It doesn't make sense when a woman is bleeding, and the next thing is to start management by rubbing the stomach, by giving the medication, by calling other paramedicals to come and take and handle. Then they will find out why the woman is bleeding. If there is tears, they will quickly take to the theater, do the suturing. Whatever goes wrong, while the woman is bleeding, it will be taken care of. But if the woman delivers, where there's no this knowledge, the woman can die. So bleeding after delivery most time is common if a woman delivers where they don't have the basic knowledge of what to do, how to handle a woman that is bleeding after delivery. Okay, so prevention, and again, going to deliver in the hospital where proper management can be given in case this kind of complication arise. So this is my reply to that post I saw, that why should a woman that is bringing a life and by it can happen. It can happen. But it can be reduced, or we can have uh less of it if women take appropriate care of themselves during pregnancy, and again going to deliver in the hospital. And the woman alone cannot do it. It has to be with the support of the spouse. That is why this channel, I always talk to a man and a woman. This is mom and dad midwife. Pregnancy is not for the woman alone. The husband, the wife, the family. Because during pregnancy, the woman can even have anemia, which after, if she does not deliver in the hospital, even when she delivers in the hospital, the woman that have anemia is prone to bleeding. So pregnancy, the woman have to register early, how to prevent bleeding, how to prevent a woman dying after giving birth. One, she have to register early. She have to go for her antenatal regularly. She have to go and report in case of any concern early. And she have to also go and deliver in that hospital. Even though she does not reach the hospital where she registered, she have to go to the hospital, not by a woman going to a very good hospital where they have all the professionals. And when she's going into labor, then she will remember one backyard made, not, I don't know, birth attendants, all those people that can take her delivery, because I cannot give them a professional name. That is when she will remember one of our friends deliver in so place, and she wants to go there. Complication can arise. But if she goes to the hospital where she will register and any complication arise, which is possible, it will be immediately be taken care of. Registering early, going to antenatal regularly, and going to deliver in the hospital. And even after delivery, when she goes home, she have any problem, she have any complaint, she have to go back to the hospital. Okay. Remember, prevention is better, cheaper, and safer than cure. Thank you for watching. I will see you all in my next video.